The term trigger point is commonly used to describe pain originating in the muscles or fascia, or myofascial pain. Historically, there's been some controversy associated with the term trigger points. This is partly because no one medical specialty owns the muscular system. We have neurologists for the nervous system, cardiologists for the heart, orthopedists for bones and joints, but until very recently, no one had really looked at pain originating from the muscular system. That's starting to change. I can tell you from my years of clinical experience that trigger points are very real, very common, and play a major role in most back and neck pain. So what are trigger points? I'm going to keep this very simple and general. If you want a detailed explanation of what they are, I highly recommend Myofascial Pain and Dysfunction by Drs. Simon and Travell. It's considered the gold standard on trigger point pain by the medical community. To keep it simple, trigger point is basically a spasm in part of a muscle or muscles. This spasm causes pain. The pain from a trigger point can either happen where the trigger point is, or more commonly, in a referred area. These referral patterns are the same across all people. They've been widely studied, documented, and can be predictable. A trained professional can diagnose trigger points by seeing these pain patterns, but for you, they may be very difficult to understand and treat. Oftentimes, where it hurts is not where the trigger point occurs. For example, trigger points in the muscles at the base of the skull will cause headaches in the temporal region. Trigger points in the gluteus medius, a muscle in the buttocks, will cause pain in the low back. So what causes a trigger point? Trigger points are caused when a muscle is overloaded. This can be a one-off incident, like when you slip, fall, or in a car accident, or more commonly, it happens over the long term because of poor posture or repetitive movements. Think about texting will cause trigger points in the neck and shoulders, or the game of golf can cause trigger points in the low back. How do we successfully treat trigger point pain? It's a two-part process. The first part you're probably familiar with, and a lot of therapists are very good at it. We use techniques to temporarily relieve that spasm. Some examples include adjustments, injections, or massage. We're about to teach you a technique that you can use with a ball or your own hands to compress the trigger points. Compressing a trigger point cuts off the blood supply to that spasm, causing the spasm to relax. A note of caution: self-release of trigger points is a very difficult to master skill. Pay very close attention to each video. There's also a small amount of risk inherent to this process. There are other tissues involved in the areas where you're going to try to find and compress trigger points. For instance, trigger points in the glutes. There's also the sciatic nerve in there. There's bursa. And if you hit one of those things, and especially if you compress it for a long time, you can cause significant pain and damage. So watch closely each video and be very careful with this. Okay, I know that was a lot to take in. So let's go ahead and get started with this very important but difficult concept to master. Never miss the latest videos from your Dr. Design fitness experts. Subscribe now.